Hi, I'm Dr. Gary Motykie, and I'm a board-certified Beverly Hills plastic surgeon. And today we're going to talk about the recent BBL reversal trend. I think it's actually a good thing. I wanted to dive in a little bit, talk a little bit about BBLs, which stands for Brazilian butt lifts. Although I think more recently, or in the recent past, I would consider them more Brazilian butt augs or augmentations. So it's kind of a misnomer of sorts. I want to talk a little bit about the procedure, kind of who are the icons of this procedure, how it got started, and possibly why now we're seeing this trend of reversing the BBLs. Over probably the last decade, it seemed to, like other trends, the butts just kept getting bigger and bigger and bigger, and everybody was trying to get theirs bigger than the last bigger one. I even think about that old song, Baby Got Back. I think in there he says, 36, 24, 36, only if they're 5'3". Now I would say it's more like 36, 24, 86. And everything seems to have gotten way out of proportion. And those extremes, like I always say, are not necessarily a good thing. One thing to talk about is why did we see this trend? And I think there was two main reasons. One was, again, the icons of somewhat beauty and social media, like the Kardashians and a lot of other people on social media were showing bigger and bigger butts, and so it set this trend of that was the ideal shape of the body. And then I think number two was an improvement in the techniques of creating bigger butts. So in the past, the main procedure for butt augmentation was a butt implant, and that procedure was fraught with complications and issues. There's a large scar to put in the implant. The implant could only be put in one location. It shaped the butt somewhat, but it also gave the appearance of what we call like a bubble butt, where the implants would be kind of not blended with the rest of the butt. And then there was risk of the implants extruding, getting infected, moving. So the procedure never really got extremely popular. Now what changed was the procedures improved. We came up with the BBL, or the Brazilian butt lift, and that involved taking fat from somewhere else in the body through liposuction and injecting into the butt. Now this procedure was scarless. It didn't come with the implants, it didn't come with the wrists, it didn't come with all the long-term issues with the implant shifting or changing. So the procedure really advanced, and as we improved the ability of the fat to live and take, the procedure became more and more popular. More recently, one of the advantages of the Brazilian butt lift was you can do more than one. So you don't really put in more than one butt implant, but you can go back and do multiple BBLs. So you can go do one procedure, then do another BBL on top of that procedure, and you can gradually increase the size of the butt, change the shape of the butt, do it to the hips, the sides, the front. You can really blend everything really well. And there's even some patients that have a butt implant and then put a BBL over the implant. So now we're getting into the realm of, rather large butts. One other thing that was an improvement was also artificial injectable fillers in the butt. So those came along more recently, things like Sculptra, Renuva, and patients were injecting this into the butt, particularly if they didn't have any fat. So what do you do if you don't have any fat and you want to do a BBL? Your only other option was a butt implant, which came with those complications, or the artificial fillers. Now, one of the drawbacks I have to mention about the artificial fillers is the volume you have to inject to achieve any noticeable difference is a lot, and that means very expensive. Those procedures where if you can take your own fat, which is free and people have sort of readily available, made a lot more sense. So I think that's why we saw this explosion in this trend. One was the icons and the image of the body and the butt, and then two was the improvement in the procedures to create those bigger butts. And one thing I do want to say, whenever we're talking about Brazilian butt augmentations or butt augs, is don't inject silicone into your butt. So hopefully that is a thing of the past. So that is one improvement, again, that we've seen. A lot of people are steering away from these hotel room injections of illegal silicone because it's very dangerous. The initial procedure can be dangerous as far as getting infections and lumps in the butt, and then long-term complications with that silicone, again, forming scar tissue, extruding, a lot of long-term complications. So again, I think that improvement using patients' own fat or the artificial fillers has improved the safety as well as the effectiveness of the procedure. One last thing about Brazilian butt lifts. It's not a minor surgery. Even though it's exploded and there's a trend, there's a lot of people jumping in the field and doing BBLs that aren't necessarily surgeons or trained to do these surgeries. And I just want to let people know that in inexperienced hands, this can be a very dangerous procedure. And mainly for two reasons. It's two surgeries in one. So the liposuction itself can be a dangerous procedure in inexperienced hands because we're actually sucking the fat out of areas, and it can be dangerous. You're putting a metal rod into the body and you have to know your anatomy. And also comes along liposuction is the type of technique, the anesthesia, the tumescent. There's a lot of risks involved with just liposuction alone in inexperienced hands. And then number 2 is the BBL portion where we're injecting the fat back into the butt. Again, there's some very large, deep veins there that can be dangerous. If that fat's injected into those veins, it can go straight to the lungs and it can kill somebody. So again, in inexperienced hands that don't know their anatomy, this can be a dangerous procedure. And then the last thing I want to say about it is, like I always say, the less extreme the surgery, the less risky the surgery. So even if all the other things are done safely, if the liposuction is too extreme, that can be dangerous. And if the amount of fat that's injected in one procedure is too extreme, that can be dangerous. And the reason is, again, it can go into those veins, but secondly, if the fat is over-injected and too much is put in there, it won't survive, it won't live, and something will happen called fat necrosis, where the fat will die, and then that can lead to infections and scarring and problems with the butt. So I tell people, again, in all of procedures, steer away from the extreme versions of the procedures, because that's when the risk of complication goes up. Having said all that, I don't want to scare anybody away from this procedure. Like I said, done in a conservative manner with an experienced surgeon who's board certified. This is a very safe procedure. You know, like I said, it's advanced so dramatically over the last decade or so that if done properly, it's very safe, very effective, and patients are very happy with it. And I tend to tell patients to lean more towards the Brazilian butt lift and the Brazilian butt aug. And again, that just means how extreme you're going with it. Don't go super extreme in one setting. Like I said, maybe do a little bit, and then later on in your future, if you want to add a little bit more, you can, but try not to go extreme with the first surgery at least. So I guess it's Kardashian time. So I think the first Kardashian we should talk about is Khloe. And I think Khloe has denied butt implant or butt aug rumors for years. I think in 2014 it kind of came to a head where there was some tweets going in and out, and she was saying that she's never done anything to her butt, that all it is going to the gym and working out and doing squats, and that made her butt bigger. The only thing I see about that is butts don't magically grow that big that fast, particularly if nothing else on the body has changed. So if you're working out and the rest of your body is slimming down, or the rest of the body is getting more muscular and everything is growing in proportion, that's usually working out. Or the other way, losing weight and it's getting smaller. But when one part of the anatomy just all of a sudden gets a lot larger, that's usually some sort of surgery or some sort of injection. So one other thing I want to mention about Brazilian butt augmentations and Khloe in general is that sometime around 2018, she got pregnant with her first child, and we saw that the butt got a lot bigger. And again, that's some of the, overall she gained a little weight. And what some people don't realize is that that fat that's transferred into the butt is living fat. So it's going to behave like fat anywhere else on the body. So during pregnancy or gaining weight, that butt's going to get bigger and bigger as well. Not just in particular her, but in general, it makes me more suspicious of a Brazilian butt lift or augmentation with fat when I see those butts get a lot larger with pregnancy or weight gain, because again, that butt's gonna expand and that fat's gonna get larger. So at that point, we saw her butt get really big. And then it's interesting because there's a dramatic change more recently, right? So we went from this rather large butt to recently, about a year ago, we see that her butt shrunk quite a bit. And I think we're calling, some people are calling it kind of the country club BBL, or just the smaller, kind of more respectable BBL. Now, there's also the fact that she probably lost weight as well. So just like with the pregnancy and gaining weight, the butt gets bigger. If she loses weight, the butt will shrink. So there's probably some of that as well going on with the weight loss. And then more recently, Khloe, we see the butt's even smaller, but she's even smaller. So again, there could have been some weight loss there. And then in general, when we see dramatic reductions in the butt, it's just the opposite. You liposuction the butt. So instead of injecting the fat, you remove the fat through liposuction in the butt, and you can shrink the butt. If it was a butt implant, you take out the implant. If it's both, you can take out the implant and liposuction the butt. But I will say, when there's a really dramatic change, the concern is that, then it might involve what's called a butt lift or scars on the butt. So it's really hard to say, because it is a very dramatic change. So now we're going to move on to Khloe's sister, Kim Kardashian. She also denies ever having surgery on her butt, but we have seen her butt go from small to really big, back to small again. So what do we think is going on here? If you look at her back in 2008, you can see she has a proportional, shapely butt. It doesn't look out of proportion the rest of her body. And then over the next decade or so, we sort of see the butt kind of getting bigger and bigger and bigger. And if we look at some of the photos posted around 2017, 2018, we see that Kim's butt is quite out of proportion to the rest of her body. Some of the photos that were leaked that were untouched and other photos around, you can see that the butt has significantly increased in size. And I think this is somewhat through that decade is what started this trend, them being the icons and the social media influencers. People started seeing the trend of the bigger butts, and I think that started as long with, like I said, the procedures getting more effective, this trend of bigger and bigger butts. Now, the only thing I can say about that again is that I'm not a huge fan of trends or fads in surgery, because the extreme looks eventually will go out of style. In some cases, when they're really extreme, they're difficult to correct or sometimes impossible to correct. So that's the reason I tell people, again, steer away from those trends. And as we can see now, the trend is switching. So we're going to probably be seeing a lot more of this reversal trend in the near future. Overall, I think it's a good trend this time to see celebrities sort of reversing extreme surgeries and reversing these extreme BBLs, or any extreme surgery for that matter. As they say, a butt on a stick is not a great look, and it's not going to age well. That's the other thing. So similar to the extremely large breasts we were seeing maybe in the 80s and 90s, where women went really large with their breast implants, over time it didn't age well. They started to droop and sag, and they needed to go with smaller implants, and then they needed breast lifts with scars. It led to a lot of problems, and I think we're going to start seeing a similar trend with the butts that were overly extremely done. Also, like I said, they have to be careful, because some patients don't realize with weight gain, with pregnancy, other things, because it is fat, it can change and get even bigger. So we are seeing this trend with patients coming in and want to reduce the size of the BBLs. And I think that's a move in the right direction. And if they do it young enough and with lipo, I think it can be done very effectively with minimal scarring.